Face-to-face symptom triage tutorial for use in the clinic setting. If you are using F2F triage for the emergency department, please view F2F ED triage tutorial. F2F symptom triage requires the birth, gender, and the age of the patient to be entered. Triage algorithms are both gender and age specific. So select the gender of the patient in front of you in the clinic, and then we will need to enter in the patient's date of birth to calculate an age. To change the age, you can use the plus or minuses, or you may highlight and use your keyboard to free text. We then hit set date to convert this to a 70-year-old male patient and hit set date once again. I'm now ready to enter in the patient name on the screen. It is recommended that you do enter on this page the patient's first and last names, as you are not connected into Vista using the web version of F2F Symptom Triage, and you'll want to make sure you copy and paste the final triage note into the correct patient medical record. So I'll go ahead and type in that this is Harold Smith. The other information is all optional, and it's not recommended that you do this. You've already taken the blood pressure and the heart rate, and you've already entered it into CPRS, so no need to re-enter it here on this start screen. When necessary, inside the expert system during the triage interview, F2F Symptom Triage will prompt you for a vital sign or other values and measures when needed. So go ahead and select Start. We're going to go ahead and now and type in our chief complaint symptom. In this case, the patient told me they were having a headache. So I type in the letters HEAD, and headache appears in my menu. Select headache as my chief complaint. The first question you will see, which does not drive the program, is the duration of the headache. You'll want to ask the patient how long have they been experiencing this particular headache. And you can enter in using the numeric value and then minutes, hours, days, weeks, months, and years. So we'll say 6 hours in this particular case, and then we'll select Next. Before we proceed through the interview questions, I just want to let you know that triage contains both objective and subjective questions. During the triage interview, you may auto-answer objective questions using your nursing knowledge, skills, and assessment. You may also answer the questions by viewing the patient problem list in CPRS, but keep in mind that things change between clinic visits, and the patient may have had a new diagnosis that is not yet entered into the problem list. So let's continue forward and talk about what's on this screen. We see there's a rationale. It's telling you why I'm asking this particular question. We also have a demographics. A demographics will include the chief complaint, the gender, and the age of the patient. Values and measures, anything that we collect when prompted in triage will be recorded in this section. It will also include the duration of the chief complaint. So now we're going to go ahead and proceed through the questions. We're going to ask the questions to the patient exactly as they're written. We're going to answer with a yes or a no. If the patient does not know the answer, we can try to push for an answer, but if not, we answer the question no. So let's go through the questions. We'd ask in the logical structured flow as they are presented to us. Here's a biometric of a temperature. I'm not going to ask the patient, have you measured your temperature? Because I did that at triage. I'm going to auto answer this question, and then I'm going to enter in the patient's temperature as I recorded it at the beginning of triage in CPRS. I'll then select Next. Now we're going to ask a subjective question, and we're going to ask more subjective questions. As you can see, a findings tab opens up. This is how we're recording in medical language as HPI or PMH, how we responded and answered the question. This is how your provider will read the final note written in medical language for their rapid review. We may also use the findings tab if we'd like to use as a reference if we need to change an answer. If you need to change the answer, you can use the back button, but I suggest you only proceed back 1 or 2 questions to change the answer. If you have to go all the way back to the beginning, it's better just to continue forward from the question set that you're on. So we're going to go ahead and answer these questions. We're going to ask the patient. We're going to ask all of these questions about the headache. We're going to ask about eye pain. We're going to ask looking for those central nervous system disorders. We're going to continue through. We're going to ask if they're being treated for high blood pressure. Now, that might be a question you see in their past medical history, in the problem list, and auto answer. And in this case, the expert system has now collected enough information to determine a system concern, a recommendation, and predicted resources. So let's go through the results screen. One thing about reaching the results, I can't go back to Q&A. I must move forward. The system concern is what the system could not rule out and why the patient is worthy of an exam by a provider. System concern is not a diagnosis and it will not be included in your final note. The triage class is the ESI, Emergency Severity Index. We will return back within F2F Triage a class 2, 3, 4, and 5. A class 2 should be seen before a 3 before a 4 and a 5, a 4 before a 5. Perhaps the 4 and 5s can go to the waiting room and wait, but a 2 and 3 may need to be roomed right away. Also, there are time frames within the ESI. I would refer you to your nursing leadership as to the time frames in an ESI 2, 3, 4, and 5 after the completion of the triage questions. How soon should a provider actually see that patient? Here is where you as a nurse using your judgment can up or down triage the class. If I really want to make this patient a 2, I could do so. Predicted resources. Predicted resources will be included on a class 2 and 3, 4 and 5, and it will tell you that the patient is at a higher risk for requiring such things in this example as blood testing, CT, EKG, IV, and perhaps admission. Predicted resources like the system concern will not be recorded in your final note. Now what I'll do is I will select note, and my final note is written in a logical structured flow. But I'm not connected into CPRS or Vista. I want to get this note into Vista. To do so, I'm going to have to go ahead and copy the note and then paste that note into a CPRS template. Also, when copying a note, please do not use the select all function that will appear as the white space here has hidden code written in it in informatics. Select done. In the event that you forgot to copy the note prior to selecting done and returning back to the start page, F2F Symptom Triage has also created a PDF. You can open the PDF, copy that information, or you can save it. Again, I'm going to ask that you refer back to your nursing leadership if you use a PDF. But in this case, I could open the PDF, I could copy this information, and then I could paste it into CPRS. So for time's sake, I'm going to say that I did another triage, and this ended with a system concern of pyelonephritis and UTI. As you can see, I have directives. Directives might be heart auscultation, set up for lung auscultation. And in this case, before I close out the note, I might want to get a dip urine and a finger stick because this patient was a diabetic. I also have the blood predicted resources that I could send the patient off to a lab to get the urine and to do a finger stick. But if you're doing it at the bedside, perhaps you could enter in the information, and what's going to be recorded in my final note is actually that information that I entered so my provider can see that I already went ahead and did a dip urine. We also end at times in our triage F2F as a refer to virtual care. If you are not performing virtual care, uncheck virtual care so it's not recorded in your note. Also, there will be directives when it is suggested that virtual care could be done to image certain aspects or anatomy of the patient. You can just ignore those images. But again, here's one for setup for auscultation. In this case, the doctor may want to listen to their lungs and heart during the exam for a sore throat. In this example, I'm going to say that the patient, I'm in the middle of a triage of chest pain, and the patient A collapses, B decides to not answer any more questions and walks away. I will want to keep this documentation and put it into CPRS for my provider. To do an early termination in face-to-face triage, simply go to results. You can change the triage class to what is ever appropriate and then make your final note. That way your doctor will see what happened and document patient walked away from the triage nurse, refused to answer questions, or in this case, perhaps the patient collapsed during triage. You may also elect if you have done a triage or you are in the middle of a triage and you're in the wrong patient chart or you want to start completely over, you may use the abort function. Go ahead and say, okay, that means my information will be gone and I will have to start over. That would be if I'm in the wrong patient chart or if I want to go from a triage such as toe pain to chest pain. If you have any questions regarding F2F triage, please defer to your visit or your nursing leadership, or you can contact us through our corporate website. Happy triage.